Dr. Quinn, the FDA approving that COVID booster shot for kids aged 12 to 15. A CDC advisory panel still has to review that. But how much of an impact do you think that decision makes on the number of COVID cases and hospitalizations?
Adrian, I actually shared on yesterday a story about this. We were so excited. There's so much enthusiasm in the medical community because at the end of the day, we want to help our patients. And the data is overwhelmingly demonstrating if you can get individuals vaccinated, their immunity goes up. But if they get that booster, then they have that extra protection. And our children, they weren't eligible under the age of 16. But now, once we can give boosters to children 12 years and older, they can get that protection that they really need, especially now with children going back into the classroom. So we are very excited, and we just can't wait for the FDA to go ahead and work with the CDC to sign off so we can get those boosters going for those children 12 years and up.
Dr. Quinn, you know that I have so much respect for you and everybody in the medical community, but that didn't really sound like the answer to the question. I'm glad you're excited about it. But we don't have as many children being hospitalized as we have adults being hospitalized. So for those who are concerned about whether or not this would actually stem the spread of the virus, do you think that vaccinating our children with this booster is going to help in the larger picture?
Almost definitely. I mean, in addition to helping the children have that extra protection, especially right now with them going back into the schools, we have to remember this new Omicron variant. It's milder in the symptoms for most people, including children. So a lot of children that don't have that extra protection, they have a higher probability of contracting COVID. They may have mild symptoms. They go home to their mother, their father, their grandmother, their aunts. They go home to vulnerable adults who may be elderly or have compromised immune systems due to chronic medical conditions. They, in a lot of cases, unfortunately serve as carriers, passing it on to others. But with children getting these boosters, now there can be a decrease in the infection rate, a decrease in carrying this virus to others, and we can decrease people getting sick, hospitalizations, and so on and so on. So this is good on so many different frontiers.
But it's interesting because in terms of the data, we know that Omicron has presented milder symptoms. So even those who are elderly, even those who are, not immunocompromised, we're seeing that there are milder symptoms. So whether children are the carriers or not, are we seeing more people in the hospital with the Delta strain of this variant versus Omicron? Because again, with those milder symptoms, the need for hospitalization isn't there like it is with Delta.
Well, you have to look at the numbers. At this point, the Omicron variant is so infectious because we have to remember that spike protein, the part of the virus that allows the virus to latch onto cells and invade and infect, it has many mutations, which makes it much more infectious. And as you get those numbers up, those numbers so high, there's a higher probability that people that are vulnerable, those that are elderly, those that have chronic medical conditions, weakened immune systems, there's a higher probability that they will get infected. And that's what's driving these hospitalization rates up so high. So the take home is we have to vaccinate as many people as possible, get those boosters out if they have not already done so, especially with these young children 12 years and older, because as I said before, in a lot of cases, they serve as carriers.
Do you think that we're ever going to have any alternative treatments for the parents who are concerned about the mRNA vaccines?
There are a lot of different things on the horizon that are coming up. We actually, in our clinic, work with different pharmaceutical companies. We do clinical research. So we just have to be patient, but understand right now our number one weapon in this war are our vaccinations and our mitigative strategies, such as wearing our masks, social distancing, and those boosters. That is such a big triumph in this war against this COVID pandemic that we're dealing with right now.
A lot of people in the medical community wanting to do everything we can to protect children and families. Thank you so much, Dr. Quinn, for being with us as always.
Hey, thank you for having me.
Absolutely.